and welcome to episode 9 of CMTV. I'm Aubrey going.
And I'm Alison Kavanagh.
So today we've got a couple of different topics to talk about. I think you had some interesting stuff. Do you want to give us a brief overview of what you're going to talk about, Ali?
Yeah, I'm interested in hormone disruptors, chemicals that can influence the body and how hormones are interact.
Cool. I'm going to be talking about I suppose, structures at the back of the knee. One muscle in particular. I had a couple of clients recently actually with two different back of knee pains that were muscular in origin. So we're going to talk a little bit about those two different scenarios. Mostly we're going to be focusing on one, and I suppose one of my pet peeves, or we could say one of my hobby horse topics that I like to talk about, contributing factors to almost every type of knee pain. So that endocrine disruptor stuff sounds really interesting. Do you want to start with that?
Yeah, sure.
Okay.
Um, I think because I've suffered with digestive issues, bloating, skin conditions, tendency to asthma, eczema, I'm always on the lookout for uh, what helps and what hinders.
Mm,
So it brought me onto the area of looking into endocrine disruptors or hormone disruptors.
mm.
So they're shortened to EDCs, uh,
Endocrine
endocrine
disrupting
chemicals.
chemicals, EDC. Okay.
Yeah, and they're found in a number of different things. Our reason for the concern is that if the hormone system is interfered with, it can have knock-on consequences to our health.
So yeah, we were saying that they can either mimic, block, or interfere with the body's hormones. So what are the body's hormones primarily?
Well, we're talking about the endocrine glands, the ductless glands. They produce hormones that influence everything from growth, repair, metabolism, reproduction, fertility, on and on the list goes. So yeah, they're really essential to the homeostasis, the keeping everything
Hmm.
in balance and on an even keel.
I suppose from an anatomy standpoint, we'd always kind of think of communication within the body, that fast but short duration communication is oftentimes through the nervous system.
Yeah,
And then when the body wants more of a sustained response, it tends to use the endocrine system and the production of chemical messengers like hormones
yeah.
to create responses that are longer in
Long
duration.
term, yeah, a
Okay.
target site, and obviously the female reproductive cycle and so on. So there's huge implications for fertility, and I think where fertility has really become concern for a lot of people, they're now looking at why has the birth rate dropped and the fertility rate dropped, and we have to look at the environment and stuff that's maybe in the air and water and chemicals.
Mm.
So I wanted to look at some of these chemicals, what they are, and then how they can influence obesity, diabetes, digestive issues, thyroid problems, skin conditions, so that we can make simple swaps and changes for things that we're using every day, that we could just swap it out for something that doesn't have a hormone disruptor in it.
I think that's kind of the problem, that a lot of these things are insidious, that they're not really very obvious. Like people don't associate, well, oftentimes I think they don't think about hormone disruptors. They'd be aware of the outcome, the symptoms that they're getting,
Sure.
but not necessarily connected back to where that might be coming from, what are the factors that might exacerbate their condition, or choices that they could make that might alleviate symptoms for them. That trying to find out where these things are, because they tend to be hidden in the list of ingredients in a lot of things, and usually have long chemical names that people just go, oh, whatever, and don't pay too much attention to it. So it might be worthwhile talking about some of the different ones, the different chemicals that people
Yeah.
recognize the names.
Some are we may be familiar with already. Say BPA. That has been highlighted recently. Bisphenol A. So it's used to make plastics and resins, but it's particularly found in glassware and in lining canned food, and that can leach into the food substance and then we ingest it. So that's
Okay.
a fairly well-known hormone disruptor.
I think most people would be starting to get familiar with some of the use of plastics, but not necessarily
Yeah.
why. So
Yes.
BPA is the
BPA is,
event.
yeah, it tends to leach from plastics, and this is quite relevant, say, for food storage. That if you store foods, particularly fatty foods, in plastic containers, it can leach more easily into the food through the
Okay.
fats. Yeah.
Uh, are some of them fat soluble then?
Yes.
Ah, so that's why fatty foods in particular.
Yeah.
will tend to absorb those chemicals more.
Yeah.
And I presume that
Right.
follows through into the fatty tissues of our body, probably.
Yes, yeah,
Okay.
absolutely. So even avoiding reheating food in containers, we'll probably come to that at the end. What are
Right.
the swaps and so on?
Yeah.
But use glass containers for food storage, and even with cling film or saran wrap, as they call it in the States, to avoid that coming into direct contact with food. If you must use it, have it cover the dish, but not in direct contact with the
Okay.
food.
So don't wrap it
Right,
in. Okay.
the
Yeah.
saran
Yeah.
wrap or
But
cling film.
over it just short term wouldn't be as bad.
Yeah.
Because always with these things, like complete elimination can be difficult, if not nearly impossible. So what we're talking about mostly is minimizing
Exposure,
to the greatest extent.
yeah,
Okay.
and avoiding where possible. So atrazine is another one. It's a herbicide. It's used to control weeds in the production when they're making like corn and soy and sugarcane. But they've recently discovered that it can actually turn male frogs into female frogs. So we're talking about
So
serious.
yeah, because there was like Alex Jones famously screaming, "They're turning the frogs gay!" and everybody, like, it sounded really quite nuts. And maybe that is an overstatement, but they did find that frogs exposed to
Atrazine.
atrazine, it did affect them because they are one of those species that can change.
Yeah.
That's just an extreme example. Obviously, it's not going to turn, and it won't have the same impact on humans, presumably, but will have
Affecting,
influences,
yeah,
similar influence.
affecting fertility,
Okay.
yeah, and reproductive, like sperm count and so on. So definitely a herbicide to minimize or avoid.
Hmm.
Dioxin's another herbicide. It's often used in bleaching paper, and it can affect the signaling system of the reproductive hormones. So again, another
Actually
break in that
disrupting this signal. Okay.
the
Yeah.
the yeah correct signaling. A big one I think is glyphosate.
Hmm.
Again, another herbicide. It causes oxidative stress. It can damage the liver and kidneys, and it really affects the gut lining. So this chemical was used actually in processing grains. That when it's applied, it dries it out and it pushes out more seeds. It gives slightly higher yield.
Hmm.
It was also used as a weed killer, Roundup,
Yeah.
where they kind of the two guns and they come out spraying everything. I think in the States they spray the highways with it in schoolyards and stuff. But they're finding now that it really damages the gut lining where there's like a Velcro that holds the lining together,
Hmm.
and that can interfere with that lining and lead to leaky gut. Things get through that trigger the immune system and can cause autoimmune responses and so on. But yeah, glyphosate,
It's interesting because I think by the nature of the digestive lining, it has to be quite thin because you need absorption across that barrier.
yeah,
So the blood vessels are quite close. Oftentimes they say like one cell nearly, so that any disruption in that means things can easily cross over into the bloodstream from the gut.
yes,
And obviously that's something we don't want. Whereas the external skin on our body, while it has its sensitivities, it has many more layers and so much more protection. And even the top layers are keratinized, they're kind of like dead skin.
yes,
So there's much more protection on the outside.
yeah,
The inside would be comparatively more fragile then.
yeah,
I
absolutely,
think glyphosate is probably one of the better known ones. I think that really came to prominence. Wasn't there a case taken where somebody proved they had gotten cancer?
yeah.
I think it was a gardener or something. So it's probably one of the better known ones.
Better highlighted one,
Okay.
yeah. Um, there's a few other ones, perchlorate, that can affect thyroid function. It actually competes with iodine in the body. So if there was any thyroid issues, that would definitely be one to avoid. It's
Yeah.
kind of found in, it's used for rocket fuel and it's found in like explosives, but fireworks. So particularly where we've just had Halloween fairly recently, always washing the hands, making sure there's no
Yeah.
chemical residue. So that's one to
Yeah.
avoid.
You're not a firework. Yeah. That sounds pretty severe. I mean, think
Yeah.
about how prevalent thyroid dysfunction is becoming.
Yes.
Some people more prone to underactive thyroid, some people to overactive.
Yes.
So that's going to disrupt thyroid function as well. Hmm.
But the fact that it competes with iodine, and iodine is so necessary for the thyroid to function correctly.
Yeah,
Yeah.
which is
So
massively influential then on your metabolic rate as well.
yes,
Thyroid
exactly.
generally controlling metabolic rate.
Yeah, the rate at which we burn our calories. So
Yeah, don't want to be
again,
interfering with that.
linking in with maybe tendency to obesity and so on, other related issues. Um, Polyfluoroalkyl substances. Some of these are tongue twisters. uh, PFAS. So
Okay.
basically, it's substances found in like coatings, um, similar to what's used on non-stick pans.
Oh, yeah.
And if this substance particularly becomes damaged, it can really interfere with it breaking off and getting into the food and being ingested. Um,
They'd say as well, even when heated, it gives off chemicals like they aerosolize,
yeah,
they go into the air
yeah,
when heated quite hot.
yeah.
So not nearly as safe as originally thought when those things were being manufactured and popularized.
And there's useful hints and tips for swaps and exchanges in terms of cookware,
Yeah.
using stainless steel or cast iron or ceramic dishes
Mm.
where possible. So do the research on that. And definitely, if a non-stick pan is damaged, get rid of it.
Yeah.
Don't cook with it.
And not to panic people, obviously,
No,
these things
no.
aren't going to like, cause instant death or they never would have survived. But
Yeah,
again, we're talking about minimizing.
yeah,
So as you're replacing things, look for alternatives
yeah,
that you don't necessarily have to go and throw things out. Unless, as you said, if they're damaged, they probably should be thrown out straight
yeah,
away.
yeah,
If scratches in your pan and things like that.
yeah.
They talk about even like micro scratches can be harmful that
Yes,
sometimes you don't even see them. But if you can see them,
yes,
there's obvious damage,
yeah.
it might be time to replace that cookware.
Absolutely.
Mm.
So it's not a case of one and done, one exposure, and it's life threatening. Not by any means. All of
Mm.
these things are cumulative. We say this even with diet. If you look at everything you ate and drank and analyzed it, you probably wouldn't eat anything. So it's really important to be realistic and make the changes where necessary. Just be mindful of it and bring it into your day to day, but don't get obsessed with it or you know we don't want to
Yeah,
catastrophize it.
we're probably a little odd compared to most people. Certainly for me, anyway, I do tend to experiment a certain amount, that I will try things out for a period of time and see what kind of effect they have.
Hmm.
And one of the things that really highlighted for me was the things you think you like are oftentimes actually just preferences and habits that you've built up over time. And that when you change your habit, your preference changes. That within sometimes a couple of days, sometimes a couple of weeks, you find, oh, I actually like this thing now that I was using as a substitute, which originally, because it tasted different to what I was used to, going back to habit, I didn't like it as much.
Hmm.
But now, as I get used to that, as my habit changes, I now like that.
Yeah,
Like stopping putting sugar in your coffee was a big one for me.
sure.
That initially the coffee was like, whoa.
Yeah.
And within a couple of days, you're like, man, it's not bad. And now I much preferred if I had coffee with sugar in it. I'd be like,
Ugh.
it's so sweet.
Yeah, yeah.
So
We're
bear that
very
in mind that
adaptable.
the things that you think you like are actually just things that you become accustomed to a certain extent.
Yeah.
Yeah.
We tend to stick with what's familiar, but we can change.
Mm.
Uh, Phthalates are liquid plastics that's contained in packaging. It's also in things like nail polish, hairspray, some cleaning products. It's often listed as fragrance in shampoos and things.
Mm.
So that's another one
Big one
that's,
from plastics too. I think that one's probably getting reasonably well known now
yes.
as interfering with development during puberty.
Yeah,
Yeah.
yeah,
Okay.
brain development. So definitely want to avoid. Phytoestrogens, we're probably more aware of those. They've been around for a good while.
Mm.
Say with the plastic bottles again, particularly leaving a plastic bottle in sunlight, the heat tends to leach the um.
That one probably a little bit more obvious as well because estrogen is in
Yes,
the name of the hormone that people would be familiar with.
yeah, yeah.
So it heated plastic, like leaving a
The
water bottle like in your car or
car
something.
window and the
Okay.
sunlight shining on it is going to accelerate that process. So, important to avoid that. Triclazine, this is added as an microbial to personal care products like body washes and soaps and so on. And then there's general ones like lead and mercury. So,
Mm.
the use of lead in paint and so on, they discovered it was toxic and on children's toys and children would eat them and
Sure.
so on. Yeah, so
And even lead in pipes and all kinds of things. I think that one's well known now, and I think that's really been eliminated from an
yeah,
awful lot of
to a
people.
large extent.
Yeah.
And then mercury, so particularly in canned foods, fish food,
Mm.
they're saying that use frozen fish where possible or fresh wild
Mm.
fish. So,
Because they wouldn't actually, particularly the fatty fish that you'd be trying to eat for good, healthy marine fats,
yeah,
if there's too much exposure, then they might be absorbing some of the.
yeah, generally I'd say the larger fish absorb more mercury, so like really large fish like tuna in particular,
Okay.
and that smaller fish or with a shorter lifespan like sardines and things don't have time to build up much, so you're
Right.
nearly better off with those like sardines compared to tuna.
Smaller, shorter live fish.
Span,
Okay. And
yeah,
still would have good fats in them and
omega-3
stuff.
and
Yeah,
yeah,
yeah.
things that help to promote nucleic acids and so on.
Mm,
So that's always good for your RNA and DNA.
yeah.
Yeah. So some simple steps then to help to reduce some of these hormone disruptors with things like getting rid of the herbicides or pesticides on the food. A simple thing of rinsing your fruit in some apple cider vinegar. So just a cupful of a good apple cider vinegar into a bowl of water and soak the fruit, and it'll help to dissolve some of the
And
pesticides
presumably when it's quite dilute like that, you're not going to get any particular taste
flavor
or
from it.
fruits.
No,
Yeah,
you can
yeah.
put it in a sieve and run it through water again if you're getting a hint of anything, but
Mm,
it should be fine. So that's a pretty useful swap. We mentioned storing food in glass containers, so especially foods with a fat content in it, and not to microwave stuff in a plastic container. To get a ceramic bowl or a Pyrex bowl or a glass dish if you're going to have to heat something in the microwave.
mm,
Equally, drinking from glass bottles or stainless steel bottles, that you're not getting the plant estrogens from the plastics. So
mhm.
that's a really useful swap. Um, Back to the food, buying organic where possible. I know it's more expensive, but it really is worth it in the long run. Particularly as it applies to chicken and eggs. I
Mm,
think they're big ones
mm.
that if they're free range and organic, it's better again.
Yeah. We often tend
Um,
to talk about that as a sliding scale. That we'd say on one end you have the, mass-produced industrial farmed chicken and eggs,
yeah,
and then free range is better because at least they have some environment outdoors that they can go out and explore. They have a better quality of life.
they're not caged.
And then you have corn-fed, which is better again, and then organic kind of best of the lot. Yeah,
Yeah.
depending. That's what I'm
You know,
saying.
depending if
Sliding
they're being
scale.
sliding
Yes.
scale.
Yeah.
Yeah, yeah. So I think the organic free range chicken and eggs definitely. We mentioned the non-stick pans, switching to stainless steel or cast iron where possible, avoiding cling film or saran wrap in direct contact with food. Um,
They're saying traditionally using things like waxed cloth and stuff, like
yeah,
beeswax and things.
beeswax,
I'm really, yeah, that's an
cloth
interesting one.
to wrap food in.
Store and preserve rather than putting it in plastic.
In plastic. Yeah, that's a really good swap. Um, Even using natural cleaning products where possible. So like a white vinegar is excellent for cleaning, and baking soda and things like that, that we don't have to have as many chemicals in our day-to-day environment
Yeah.
as we have. And it's small little changes that make a huge difference.
And even using small quantities of stuff. Like sometimes when people, I know a lot of people have dishwashers now, but if you're washing dishes in the sink, people will
Yeah.
put in like big squirt of soap and like tiniest drop disperses, it emulsifies
Yeah,
as much as
the
you need.
droplets,
Or
yeah.
the same, some people with shower gel or, shampoo and it's or
Half a
even
bottle.
toothpaste. They
Yeah.
said there was a big thing from advertising where they would show you putting a length of paste, the length of the bristles on your brush. I
Yeah.
said, really, it's a pea-sized
Size of
piece.
a pea. Yeah,
Yeah.
that's all you
And
actually
even
need.
those kind of things, it's more economical as well. You're not creating waste, but you're not using as much of the stuff. You're not exposed to as many chemicals, and it's saving you money. So those are kind of simple things of just even use the appropriate quantity.
Yes.
More isn't doing any more.
Yeah.
It's just wasteful.
Yeah. If you're up to your elbows in suds, you need to
Pretty
rethink
much.
that. So I just there's a couple of useful sites for skincare products, for lotion, sunscreen, soaps. There's EWG Shoppers Guide. So it's ewg.org/food news, and you can look up different products and see what's in them. And as I said, it's just shopping sensibly
Yeah.
and getting rid of the stuff that's really going to interfere with your health.
Mm.
Here locally in Ireland, a new lady has become very popular, Sophie Morris, and she goes into supermarkets and looks at the ingredients in foods and gives you alternatives. So
Mm.
she's really growing in popularity.
Yeah, I think it's simple stuff because she'll say, "See this brand."
Yeah,
So it's going to be one you recognize from your local supermarket,
yeah,
and she'll point out which ingredients are most likely going to be an issue for you,
yeah,
and then say, "Look, it's not that you ever have to give up the foods you like. It's just make smart swaps."
yeah,
And generally, her advice is pretty good, and
yeah,
oftentimes she'll
exactly.
say where it's more economical as well. Sometimes
Yeah,
the preferred product, but I like the way, say with something like honey, she was talking about why that you're saying that the mixed honeys they're oftentimes of they're not in a regulated environment, so the bees are just fed like sugar water and stuff. So
Yeah.
the quality of the honey is poor.
Fructose, glucose,
Yeah.
syrup. Yeah.
So she'll oftentimes go into the why of it as well, which I think is nice considering they're quite short
Short
clipped.
clips.
She gets a lot in there, which is great.
Yeah, and a good focus really on children's health and feeding your kids healthy so that, the future generations can be in good health and thrive.
Mm. Excellent. Okay. And we'll put those in the show notes as well, so you can get the links to the website, and we'll probably put in Sophie Morris's
Instagram.
Instagram, social media if we can.
Yeah.
Yes. And be sure and give her a follow, because like with us, I mean, people like who are putting out information like that always will benefit from shares and likes and follows and all that kind of stuff. Helps with the algorithm.
Yeah, and get the good information out there so that people can make healthier choices.
Yeah. Anything else you want to say about that?
No, that's about sums it up.
Okay, so we are experimenting with some uh, new technology this week. So let's see if we can do a screen share and have a look at our anatomy. There we go. So this is a program that I always like using. It's 3D for Medical is the name of the company. Complete Anatomy is the app. And this is one we use to teach an awful lot, but I like it because it's very user friendly. But here I've kind of prepared it. I've highlighted the particular muscle we want to talk about, which is popliteus. Not a
Terribly well
widely
known.
talked about muscle.
Mm.
We can see here it's at the back of the knee, it's crossing the back. The other one that I would mention here is a long, thin muscle. This one is called plantaris. So you can see both of these guys are at the back of the knee, but there are other things obviously that will cause back of knee pain. Probably the one that people talk about the most will be a Baker's cyst. If there is a Baker's cyst, the area will look like it's bulging out. They'll look like there's kind of like almost edema at the back of the knee, and it'll feel kind of mushy as well. It'll usually be diagnosed because obviously as massage therapists, we're not diagnosing these things. So if in doubt, refer out,
Mm-hmm.
send the client to the doctor, get a diagnosis, see if it is a Baker's cyst, in which case we'd be looking at a different treatment approach. We're really looking at creating more joint space and seeing what is irritating that synovial lining that's causing the excess production that's causing the bulge out the back of the knee. But in this case, we're talking about muscles. So with popliteus, it's a little bit unusual because normally we would say the common dysfunction across almost all knee pain is lateral rotation of the tibia. So from the knee down, the lower leg, the big bone is the tibia, is turning outwards. So you'll see that the knee looks like it's pointed straight ahead, but the foot is turning out.
Mm-hmm.
And that kind of twist in the knee will cause tension on some of the soft tissues like the ligaments.
Mm-hmm.
So it can add to ligament stress and cause some pain around the knee from that. It tends to pull the patella with it, so it causes problems with patellar tracking. We can sometimes get damage then to the cartilage because it's not lined up properly between the ends of the femur. They look like two knuckles, these condyles.
Mm-hmm.
So we can get damage on the patella.
At the back of the knee.
Yeah, and it's at the front.
Okay.
Yeah, patellofemoral pain. I'm just saying generally about the
Oh,
things that'll,
a,
yeah,
a
kind of knee pain
chondromalacia.
that is going to be affected. What did I say?
No, I was thinking of chondromalacia patellar.
Chondromalacia, yeah,
Yeah.
that's damage to the cartilage, yeah.
Yeah.
But even just patellar tracking issues
Sure.
can cause patellofemoral pain. Um, we can have a higher risk of meniscus tear
Yeah.
and ligament injury to anterior cruciate, possibly posterior, medial and lateral collaterals. So a lot of the ligaments are more exposed to injury, we could say, or more prone to injury because they're already tensioned, and so it doesn't take much more to cause injury.
Mm-hmm.
But the muscle that tends to rotate the tibia out the most is one of the hamstrings. It's called the short head of bicep femoris. I think we can actually see it here. So if we zoom out a little bit, this is the short head. And the reason it's so important, oh, is that the short head? Nope, I'm vastus lateralis. Apologies, 1 second. There's the short head of bicep femoris. So this is unlike the other hamstrings because each of the other hamstrings attach up onto the pelvis. It's only this short head that doesn't cross the pelvis. It doesn't cross the hip, I should say.
Yeah.
But it does attach onto the back of the knee. So unlike the other hamstrings, this one is inclined to get short and tight. Every time you sit down, this muscle is shortened.
Mm-hmm.
And so if it doesn't get stretched out properly, it tends to, when we stand up, turn the tibia to get that last little bit of lengthening or extension.
Mm-hmm.
So it's kind of the main culprit in that lateral rotation. With the popliteus, instead, it is a medial rotator. So we can kind of see there's a shadow of the other muscles. We've kind of just ghosted out or faded gastroc here. So we can see popliteus underneath, soleus just down below it. So this is actually the antagonist because popliteus will actually turn the tibia in.
Mm-hmm.
And one of the things it does is it actually starts the process when we first bend our knee, it takes our knee out of lock.
Mm-hmm.
Because when the knee fully locks out, it actually twists a little bit.
Mm-hmm.
That's part of the normal biomechanics of the knee. So to take the knee out of lock, this muscle does that kind of initial thing. We always talk about the difference between short, tight muscles and weak and inhibited muscles. So usually the prime mover, we could say prime suspect in this case, that short outer bicep femoris turning the tibia out. Here, when we see that this one is turning the tibia in, this one is likely to be weak and inhibited. So I had a client in recently, and he was getting back of the knee pain when he squatted, and it was kind of just across and just below the joint, and we thought it was gastroc. But when we went in and we actually palpated just to the outside of the knee here, that was a little bit painful. We did some myofascial release and a little bit of MET for that, and then the pain went away, and he'd had that for months and months and months. And particularly, he said like it was kind of locking the knee up. He couldn't get down below a certain depth. If he went any further, there was a real sensation of pinch.
In the squat.
Yeah, in the squat position. So the other one I'd mention just briefly is a longer muscle. This one here is plantaris. It goes all the way down to the heel, which we can see if we scoot in here. It kind of blends in and comes in beside the gastroc and the soleus attachment here through what most people call the Achilles tendon, proper name being the calcaneal tendon, because the heel bone is called the calcaneum, and so this is a tendon connecting to it, so it's actually called the calcaneal tendon would be the correct anatomical name. Can't be named for the individual muscle because there's two muscles sharing it. So plantaris is kind of an assist to that. It's attaching down onto the back of the heel, just like the gastroc and soleus, but it's a little small muscle up here at the back of the knee. And sometimes people get, it was actually a student recently, had pain at the back of the knee. We did a muscle resistance test. This particular muscle is involved in plantar flexion and knee flexion, a bit like gastroc, but it's the location. The client pointed to the center of the knee. And again, this is kind of an endangerment site. You need to have good palpatory awareness. You need to be aware of the fact that there are nerves, blood vessels, and lymph nodes in this area. If you cannot tell the difference between those when you're palpating, stay out of these endangerment sites, stay out of the back of the knee. But we were able to get in and do a little bit of myofascial release, and I think maybe a trigger point, 5 minutes of treatment, retested, and there was no pain. Did squatting movements, no pain.
Excellent.
So quite important muscles in the back of the knee.
Sometimes
Kind of small.
tendon of it is harvested for grafts, is that correct? If they have to do a cruciate repair?
Yeah, they've changed that now. Recently, I've had clients come in where they take a different approach, but oftentimes, yeah, for tendon grafts, because plantaris is only an assist for soleus and gastroc, you can kind of live without it. Some people actually don't even have one. There's all these anatomical anomalies that people have. So because it's such a big long tendon, it can be useful for harvesting and use elsewhere. You know, they used to use it for cruciate ligament reconstruction, because once you screw a tendon into bones, it's connecting bone to bone. So structurally, functionally, it becomes a ligament. Because in terms of like, if you look at them under the microscope, the ligament and the tendons are almost identical. More recently, I've seen people do a procedure which I think is a little unusual. I won't say much more than that. I don't want to be PC. That they sometimes now harvest a section of the patellar ligament.
Okay.
Yeah. I don't know. It's a new procedure. I'm not going to cast it to judgment one way or the other. Yeah. Interesting approach. But I thought those muscles are worth talking about because they are deep muscles, they're small muscles, they're oftentimes quite overlooked as a result. And there's an assumption. We see this a lot. We talk about it with plantar fasciitis, that any pain in the sole of the foot, people go, oh, plantar fasciitis. Without a proper diagnosis, you don't know, is that actually the case? And again, with the back of the knee, a lot of people just go, oh, back of knee pain, it must be a Baker's cyst. There's these kind of assumptions that it is the common thing. And really, an assumption is useful if we have a diagnosis, if we have a radiographer's report, we can be better informed. But ultimately, we really want to test and see what is the client presenting with on the day. And then palpation is always the gold standard of assessment. So get in and see, is it painful to palpate?
Muscle resistance tests.
Muscle resistance tests are going to be the best ones because these are muscles. Yeah. So ordinarily we talk about active, passive, and resisted tests. Active tests being done first because they're hearing tests or safety tests, we could say. It helps us to gauge the nature and severity. And then we can do passive and resisted tests to try and pin down which structure is it, because active tests don't tell us that. They only give us nature, what kind of movement, the severity, how painful. Doesn't tell us anything about structure. So passive tests are going to test passive structures. So things that are non-contractile like ligaments, joint capsules, articulating cartilage. And then the active tests are going to test, the muscle resistance tests, which are not about range of motion. We want those to be isometric. They're going to stress the muscle, its tendon, and its attachment. So it gives us information about those. And if a muscle is the cause of your pain, you should oftentimes be able to elicit the client's recognized pain response, and that would be referred to as a positive test. So yeah, do some testing.
Yeah, exactly.
Cool. Anything else we need to mention around that?
And stretch your short head of biceps femoris,
Yeah, so
particularly after long drives or long duration sitting, because it has locked up
yeah,
and it can be stay in that shortened position, and it's again cumulative.
we might get around to demonstrating that. We're going to be adding videos like that to our streaming service, Watch HCD. So keep an eye out. We might actually put up a stretch for that short head.
Yeah,
Because again, if you're doing your home care, it's almost like what we were talking about with the endocrine disruptors, that if an activity is causing muscle imbalance, it's not that you have to stop that activity, it's that you need to maybe make a adaptation.
yeah,
So the obvious adaptation would be, if there's an action that's causing a muscle to get really tight, you should do a little bit of stretching
to counter that.
so you offset.
Yeah,
Yeah. So you don't suffer the negative outcomes, and you can still enjoy the thing you want to do, the
sure.
activity, the sport, whatever it might be, your favorite foods. If you're choosing wisely, you should be able to minimize the negative impact of any of those kind of choices.
Yeah, and small little changes make big differences overall.
Yeah. Okay. I think we're pretty much there. Anything else you wanted to say?
No, that's good.
Okay. So be sure and let us know in the comments if there's things you'd like to hear us discuss. And we said, of course, like, share, all that other good stuff.
Yeah,
And of course, if you like these videos, please do think about supporting us by signing up to our streaming service, watchhcd.ie. We have a whole ton of video on there. Our new episodes always premiere there as well. And
with
there's
lots
a,
of stuff we're going to be adding. We're
yeah,
constantly creating content, and
at the moment, an awful lot of it is around bodywork because that's kind of our main focus, but we will be adding in other areas, things like stretching, strengthening, probably some meditation at some point as
yeah,
well,
I like
breath
the
work.
mindfulness stuff,
Yeah.
the things that lower stress, because it's such a huge component in
Mhm.
all areas of our lives. So
And of course, there's a 3-day free trial, so you can check it out without any obligation. And if you like it, subscribe.
great.
Okay, well, I think we're there then.
Yeah,
Thanks for joining us, folks.
see you
And
next
we'll be
time.
back again shortly. Thanks very much.
See you then.